Hey everyone, it's Dr. Tim Whiting from Stirpe Chiropractic and Wellness Center here doing another show with Dan Tortora. Today we're going to be talking about acute low back pain. Most people have experienced at some point in their lifetime. You wake up in the morning, not sure what you did, your back's really killing you, can hardly get out of bed, maybe some muscle spasm, or maybe first thing in the morning you bend down to turn on the shower, pick something up, and your back locks up on you. So we're going to kind of go through some things that I have here in the office and things that you can be able to do at home if you can't make it into the office to kind of help take care of some of that pain until you can see somebody like myself, another chiropractor, physical therapist, or someone to actually help you solve the problem and get you out of pain fully. So biggest thing is, when you go into that spasm and get locked up, what do? We need to try to break that pain spasm cycle. Some easy things are either heat or ice. I prefer heat unless there is a initial injury where we've got some swelling and inflammation, then we can use ice. Really, it's dependent on what feels better for you at the time. I feel that heat usually helps resolve some spasm a little bit more. So this pack is one of the ones we sell in the office. There are many ones like it out there. This is a gel pack that can be put in the freezer or can be heated up in the microwave or boiling water to get nice and hot. You're going to place that in a towel and then place that right across your lower back, depending on how far up or down you're getting this pain in there. It's going to help kind of break up some of that spasm again, relax those muscles, get some blood flow to the area. But I like ones like these where you can do either or with it, have one in the freezer, have one on hand to heat up. The heating pads aren't bad that plug into the wall. They usually just don't get hot enough to do anything, or to do much, I should say. The microwavable ones are great for warmth, and then you can obviously have other ice packs. So start you off, grab a hot pack is my opinion. Get it on the back, try to relax it. Some people might have these. This one might be a little bit more odd. So this is a TENS unit, a stim unit. You might have gotten them from previous injuries. If you ever had a knee injury, shoulder injury or something, you might have gotten them from an orthopedist or a physical therapist. So they are going to look something like this. You're going to have some pads that can go onto your back or the area that's bothering you. So you're going to connect this up, connect it to the pads, and choose different programs on here. And this is going to also help block some of that pain signal and maybe take away some of that spasm as well. You can place the pads kind of in just a 4 pattern across the back. Again, that's just going to help with some initial relief. Neither of these are really solving anything. That's important to note, that these aren't really going to fix anything. This is just to help kind of alleviate that pain up front. Other things we like to be able to use, something like BioFreeze, Tiger Balm, Icy Hot, something like this. We use BioFreeze. It's been shown to usually penetrate a little bit deeper, last a little bit longer than some of the other products. Again, this is just what we use. You feel free to have whatever you've got in there. Usually the active ingredient in this is menthol. So that cooling effect as it kind of cools like alcohol will give you some pain relief. May help a little bit with spasm as well. So this is something that is nice to have on hand anytime you've got some pain going on. Other things that you may have if you're an athlete, have had injuries in the past, some kind of tape like this, rock tape, kinesio tape, spider tech tape, anything. This is huge acute back pain. Throw a couple strips right down the sides of the back here, and then one maybe across more of the trouble area. We find that helps a lot. Might be difficult to apply yourself. If you have somebody that's done it before, have them do it. Otherwise, if you come in the office, we can throw some of this on you, teach you the proper way to put it on. So again, these are initial things to help break up some of that spasm and the pain until you can kind of get into the office. Other things you need to do, I know a lot of times it's going to be hard for you to get moving. It's very difficult, what we call transitional movements. So going from the sitting to the standing position, or going from lying down to sitting up. What we want to try to do before we do any of those motions is be conscious that we're actually going to go ahead and stand up. So actually think about it, brace your abs. So I want you to kind of clamp down your abs like you're flexing them. You're going to feel it both in your abs and your low back, and then use your hands to assist you and try to stand straight up without lunging forward or without moving forward before you contract. So you're going to give yourself a nice brace, kind of hold down, clamp, hold it for a second, and then use your hands to assist you as you stand straight up and you're using your legs. This is going to help any quick movements in your low back from occurring. so you don't go into any further spasm. Same thing if you're going from laying to sitting up. Just consciously contract your abs, try to push yourself up into a seated position, slowly rest here for a second, and then do that same thing and stand up. Some simple thing that's really going to help that. I notice I see it a lot with patients when they're in the waiting room. I teach them that one little trick, and it usually helps them from that pain, just from that initial getting up out of the seat. So those are some things we can do. Also, if you have any kind of brace at home, we've got these braces in the office. We'll let patients use these over the weekend or something if they don't have one. We can order you some. We can see if we can get insurance to cover them. But these are great just for added support and stability in the back. So I'm just going to kind of go on like this. Nice. These ones are nice because they can go loose around your stomach. They're not very tight, so they don't feel like you can't breathe when you're on them. The way they tighten in the back is with these pull straps here. And as I pull these, you'll see in the back there's lace, and that tightens down the whole back without it compressing down here, so I can still breathe. I've got support in the low back. It kind of acts like almost like a corset, like it's squeezing onto your low back, helping kind of give you some stability down there. So these are great to have on hand, or if you're coming to the office, we can give you one to use in the meantime while we order you one. So these are awesome to have. Definitely my favorite one right here. A couple more little tricks. People sit wrong. So now it sounds stupid, but sitting is not as easy. This is 9 out of 10 people go to sit like this. Okay. They sit down, they lean back into this. This takes out that normal curve that you have in your lower back and flattens it out, kind of rounds your low back. It puts it into a more forced situation. So what we really want to do, I want you to back up all the way into the chair and then start by aiming your butt back towards this crease in the chair. Any chair, doesn't matter what it is, I want you to aim your butt for there. So as you get back in there, really pin that down and squeeze into there and then sit up. So instead of being rounded forward, I have that normal curve in my lower back. It's supported by this chair. If your chair is bad, you don't have a support, this is where you can get a simple towel, roll it up, get it tucked behind your low back to give you some extra support. It's a quick, easy fix to do that. Or you can invest in something like this, like a lumbar support for more permanent supports in your office. Nice one to kind of just put right behind there, sit back. Also helps push you a little bit more forward in your chair, so you're not leaning forward maybe as much to get to your desk or something. So these are a nice long-term investment, but in a pinch, rolling a towel up is not a bad way to go. Alright, next I'm going to show you two exercises to do at home, and then we're going to go into demonstration of if you came in here, I would probably do a couple of these therapies, as well as do a chiropractic adjustment to the low back, and I'm going to have Dan help me demonstrate that as we have in the past. But first, I'm just going to clear off this table and show you a couple stretches.